Welcome back. With outbreaks still happening in parts of the country, your COVID questions keep on coming. And joining us again, infectious disease specialist Dr. Isaac Bogosh. Here's the first question, Dr. Bogosh. There are reports that transmission by touching something contaminated isn't as much of a risk as we previously thought. What do you make of that?
I think it's premature to say that. I've seen some of these reports as well. And certainly, I think it still is a risk. And of course, we know that close contact with an infected person, especially in an indoor environment, is likely the highest risk scenario. But certainly we know that surfaces can be contaminated with this virus. We know the virus can live on surfaces for anywhere from 2 hours to 2 days. And of course, we know touching those surfaces and then unintentionally contaminating ourselves by touching our eyes, our nose, our mouth are certainly a way where we can get this infection. So by all means, practice good hand hygiene because this virus can stick to surfaces. And if we wash our hands or use alcohol hand sanitizer, we can certainly lower our risk of acquiring this infection.
Okay, so hand hygiene, something we often hear you talk about. Here's another thing many people talk about, which is that 6 feet or 2 meters. But here's the question, is 2 meters still enough space for physical distancing? And the context for this question may be an article or articles that I've seen floating around that suggest that maybe droplets can travel further than that.
Yeah, I've seen those articles as well. I think we have to remember that there's a lot that goes into transmitting an infection. And, just because someone might have detected a shred of the virus genetic material, perhaps on the other side of a room, or they vacuumed it up and sucked it out of a particular filter, it doesn't mean that that's infectious virus. There's a lot more that goes into it than that. You actually have to demonstrate that the virus can be cultured, or you have to have a particular dose of the virus to actually be infected with it. So, certainly we can detect shreds of genetic material all over a room when someone's infected with this virus. But in general, I believe that 2 meter distance is appropriate. It's certainly appropriate if we're outside. Indoors, it's likely very appropriate as well, although we know there's a greater probability of transmission in indoor settings compared to outdoor settings.
Yeah, it's a really interesting piece of analysis. So to sum up, keep washing your hands, and 6 feet is still good.
Absolutely. And I think the other important point that we heard Dr. Theresa Tam talk about is if we're in settings where we can't practice physical distancing, especially in indoor settings, wearing a mask can help reduce the risk of transmitting this infection from one person to another.
I hope you get some time off over the weekend, Dr. Bogosh. Thank you very much.
Thanks very much for having me.
And we will continue to look for your questions on COVID-19. You can message us directly on Instagram at CBC The National, or you can send us an email at covid@cbc.ca.